Hi, I'm Dr. Stacy Burke from West Coast Family Chiropractic. Today we're going to be going through some forearm tendon and carpal tunnel stretches and exercises for the wrist and forearm areas. Approximately 40% of the workforce are affected by repetitive stress conditions involving the wrist and forearms. So hopefully some of these stretches and exercises will help to support you in preventing that painful condition, or at least alleviating some of the symptoms if you're already experiencing some of that. First and foremost, we're going to start off with a very simple one. We're going to put the hands straight out in front of us, and we're going to put the thumb down inside of the palm with the hands in an upright plane. We're going to then wrap around the thumb, keeping the arms straight out in front of us. Then we're going to bend the hand forward, and you should feel that stretch through this part of the hand and wrist. And again, just holding that for 5 to 10 seconds, just taking it to the point of tension and then stretching it out. None of that stretch should be painful. And again, with any of the stretches that I'm going to show you, none of them should be done to the point of pain, only to the point of tension, and it should have a relieving effect when you let that go. So the first one again is thumbs. If we point the thumb straight up to the ceiling and then bring them down and wrap the fingers around the thumb, the arms straight, and then bringing the hand forward down towards the floor and stretching on top of the wrist and thumb area. The second stretch that we're going to do is we're going to take the hands again straight out in front of us. We're going to bend the fingers and then bend the wrist. So there's 2 points we're bending at the wrist and at the fingers. Then we're going to take the other hand and we're going to bend the wrist in, arms pretty much straight out, and just holding again to the point of tension, not pain, and letting that go. And again, you should feel that stretch on the back part of the top of the hand and wrist area. So we're bending the fingers in and then bending the wrist in. So there's 2 bends, 1, 2, and then stretching that with the other hand, and then gently releasing. Again, fingers in and then bending the wrist and stretching that back part of the wrist and forearm muscle area. And then give them a shake after. You can loosen the arms up. Next one we're going to do, you're going to go up to the wall area. You want to put the fingers pointing up towards the ceiling. The arms should be reasonably straight. You don't have to lock it out, but we want to keep it straight, roughly at shoulder height, facing perpendicular to the arm. What we're going to do is then turn away, and as you turn, you'll feel that stretch through the whole forearm area and into the bicep and pec, and then relaxing it. So again, the arm is straight, the fingers are pointing toward the ceiling, we're facing perpendicular to the arm, and you're just turning and stretching. You'll feel that pull all the way through, right into the fingers. Just breathing out. Gain 5 to 10 seconds in there. Do the other side. Give the arms a shake and the hands a shake after. And the next one that we're going to do, we're going to put the palm out. We're going to just take the thumb and stretch the thumb down. And again, just 5 to 10 seconds and just stretching the thumb back, and you'll feel that stretch through the inside of the hand. The next one and the last one for today is going to hold the hands straight out in front, the arms straight and the hands palms upward toward the ceiling. Take the opposite hand, you're going to traction the fingers back. Okay, again, just to the point of tension to open up that lower forearm and palm area of the wrist. Just taking it out, holding it, stretch and breathe. And the other hand, so arm is straight, the palm is facing upward, taking the fingers back with the other hand to the point of tension there, not pain. And then releasing, give them a shake, give the arms a shake. These are all very effective stretches and exercises for forearm types of tendonitis and carpal tunnel. These are 4 very simple ones. Obviously there are many others. Today we've mainly focused on those 4. They're very effective, they're safe to do. As with any of the exercises and stretches, don't do anything that's painful. If you're concerned that your condition may be worsening or not improving, if you already have existing symptoms, it would be very appropriate to speak to your medical practitioner for a further exam and consultation. I'm Stacey Burt from West Coast Family Chiropractic. Thanks for stopping by.